Later on the day, Joey's knee was still not improving, so her family brought her to a clinic. She waited for almost an hour with the exact burning sensation on her right knee. When she was called into the room, her doctor then asked what happened. Joey then explained how she quickly turned with a heavily planted foot and heard a clicking sound during the injury. During this test, the patient should be on their back with their injured knee hyperflexed as well. The examiner then holds their heel and knee joint at a nearly 90-degree angle, where the foot is turned away from the body, externally rotating the tibia, placing a force and then extended. The foot is then turned in, internally rotating the tibia, which places a force and then extended. This tests out for the medial and lateral meniscus. If you hear a pop, it is a positive injury on the meniscus. During this exam, the patient should be lying down with all their muscles relaxed, with their knee bent between a 20 to 30-degree angle. Hold the knee joint and pull on the tibia anteriorly and posteriorly against the femur. If the examiner feels no specific endpoint, the patient's ACL may be torn. During this exam, the patient is still on their back with their knee flexed at a 90-degree angle. The tibia is then pushed posteriorly, looking for a sudden drop due to a PCL tear. If there is a drop, it is a positive examination. In this examination, the patient's leg is lifted up straightly. A force is then placed on the lateral side of the knee, where there should be an endpoint on a perfectly intact MCL. The examiner may also bend the knee at a 30-degree angle, moving the tibia from side to side. This test tests out the MCL and the stability of the knee. After all these performances, the doctor asks further questions so that a solid diagnosis can be made. Did you get any of these symptoms? Popping or clicking sound? A pain or tenderness along the inner part of the knee? Swelling of the joint? Putting weight results into a feeling of giving away? And a difficulty bending? You were negative with all the other tests, which is amazing, but you were only positive with one test, which is a valgus stress test, which tests out for your MCL. So when you quickly turned around, as you said, with a heavily planted foot, that pressure on your ligament was too great and it could not handle it. So this might have caused a tear or just a minor stretch. But I will ask you to go get an x-ray to see if there are any other bones that are fractured, and also go get an MRI test to see if your ligament is actually torn. After long months of waiting, both Joey's x-rays and MRI results have came back. Nothing was found in the x-ray, therefore there weren't any fractured bones. It's great news. But if we look at her MRI results, her right knee has a torn MCL. As you can see right here, she has perfectly intact ACL, PCL, LCL, and finally her torn MCL. The little gap right here is the tear. She did not completely tear her MCL, but she was as close to tearing it completely if she further continued dancing. She saved herself by performing rice as quickly as possible.